I feel like I know when I go to Airrosti that I'm going to walk out fixed. Like I almost don't worry about what I do in practice that day because I know as soon as I go I'm going to feel better and I'm going to be able to get back out there and train in my next practice.
I would definitely recommend this to a friend. I've been pitching ever since I got hurt and no repercussions or injuries since.
What normally would take 1 to 2 weeks on an ankle sprain is down to 1 or 2 days.
A normal doctor will say ice and rest and take a few weeks off from training. And in our sport, we can't really take that much time off. It really takes about a 2 or 3 month process and puts it into a 1 or 2, maybe 3 day treatment.
The quicker that you can have Airrosti done on you after an injury happens, the quicker the improvement's going to be.
When I was 9 years old, I dislocated my elbow falling off the pommel horse. The first doctor I saw told me I should just quit the sport. The second one said I'd be out for 6 months to a year.
I was devastated for him. Gymnastics is the thing that means the most to Sam. He was upset, I was upset, and we refused to take it lying down.
My dad had just used Airrosti to help him get back from a knee injury, and he told me to go there.
Sure enough, he was cleared for full workout within 10 weeks, not 6 months to a year, but 10 weeks.
When I get older, I'd like to be an Airrosti provider.
It's just been wonderful, and Sam wants to be an Airrosti provider when he grows up, and that couldn't make me more proud.
You get treated and you don't skip a beat. You really don't skip a beat. I would never hesitate to send somebody over. It's like the first thing that comes out of my mouth now. I feel blessed within my journey as a strength training coach to come across them, to be able to integrate what I do with what they do when I need them, when the athlete needs them. It's a match made in heaven for me.
Whenever I do have an injury and I know that I'm not able to participate in a workout or I have to cut back and scale back, it does put a stop to my exercise routine. And so it's wonderful to know that I have Airrosti, that I can see someone there recover within 1 to 2 treatments and be right back where I left off.
I have never in my medical career or basketball career ever seen a young man with that kind of an ankle go back and play a day later.
It actually attacks the injury. It's not just a Band-Aid that you put over someone's injury.
He went from not being able to really put weight on his foot to being able to run. And his mom was in disbelief, had all kinds of questions. How can this be? You know, this is crazy.
Medical Edge is a large healthcare group. We have over 400 physicians in the Dallas-Fort Worth and the El Paso area. And we have Airrosti providers in many of those practices. I've been absolutely amazed at how quickly Airrosti can not only get people back to work, but get the patients feeling better, where they feel comfortable walking out of the physician's practice, where they feel comfortable returning to work and returning to their daily activities without pain and with confidence that they really have had some type of repair, some type of recovery.
For areas that are commonly affected by people who are in the workplace, shoulder injuries, back injuries, carpal tunnel, those kind of things, it works very, very well.
You want somebody to get well faster, to get back to work faster, and to spend less money on diagnostics along the way, then again, this is a no-brainer.
Airrosti is everything they say it is, and if you don't believe me, just give me a call.
After being in braces and orthotics and a cast for 3 months, I eventually was so debilitated that I qualified for a handicap placard. No grocery shopping unless you were in a wheelchair. I have been amazed that in less than 2 months' time, I'm on my feet. I can walk 5 miles a day. So it's getting back to life as normal, or maybe even better than normal.
I believe it was the 3rd or 4th treatment that was just a real breakthrough. She just felt some instantaneous relief and instantaneous range of movement improvement. And that was the miracle thing that, you know, we had heard about, and we were going, golly, it really does work.
It was a great experience just spending the whole hour with one doctor one-on-one, explaining what he was going to do and doing it.
Worked on my son, and he was walking around with a limp, and he went outside. They had him go outside in the front yard, and he said, Dad, I just ran down the block. I said, what? This is after one treatment. I said, what? He says, I just ran down the block. So I said, Royce, you got some friends that are hurt. I tell you, the technique was so good, I had parents trying to sneak in to come to my house. They acted like their kids was hurt, and the 2 parents wanted to be worked on. So I think I can charge a little extra money on my own through the Sinbad. Come in, get you fixed up. I already got them on call for this season. For when the guys get hurt, we're gonna have the Texas pipeline so we can just make it happen, keep the team healthy. And then for the other teams, I'll give them another number for some herbs they can put on their ankle, so the way they don't heal and we can beat them. It might be wrong, but that's what I'm gonna do.